afternoon. My name is Nicholas Leland. I'll be your student physical therapist today. Do you mind if I work with you?
No.
Okay. And just before we get started, can you just say for me your full name?
Lauren, me.
Good. And do you know where you are?
My house.
Right. And do you know the date?
September 18th.
Right. And why you're here?
To help you with your project.
Okay. And just before we begin, my patient is alert and oriented to person, place, time, and condition. She's also demonstrating good independent seated balance, which we'll revisit later. So today what we're going to do, Lauren, is conduct a neurological examination. Okay, so the first part of it is we're going to look at the cranial nerves. These are nerves that kind of start in your brain and end around the neck, and they control a lot of things in your face and then the rest of your body, okay? So the first thing, what I'm going to ask you to do is, can you just close one of your nostrils? Good. And then go ahead and close your eyes for me. Good. And then just sniff in and tell me what that smells like.
Coffee.
Good. And then can you close the other nostril? And same thing.
Yeah, same thing.
Okay.
Coffee.
And it smells pretty equal on both sides?
Mm-hmm.
Okay. And that was for your first cranial nerve, which is the olfactory nerve. Now what we'll do is go through the nerves that control your eyes. Okay, so the first one, what I want you to do, actually going to stand right in front of you. I just want you to stare right at my nose. I'm going to bring my hands out here, and you just point to whatever hand you see moving, okay? Great, okay. Now what I want you to do, instead of focusing on my nose, you can focus on my hands, okay? And just watch wherever my hand goes. I'm just going to keep your head still here. Good, okay. And that was assessing the cranial nerves 2, 3, 4, and 6. And now what we'll do is I'm going to just lightly brush over different parts of your face. I want you to tell me if you feel it, and as well if you feel it equal on both sides. And this is going to be testing the 5th cranial nerve, which is the trigeminal nerve, okay? Actually, can I have you close your eyes before we do this? Is that equal on both sides? Same thing, equal on both sides? Equal? Okay. And then before we move on, can I just have you bite down and make a clenched jaw really tight? Good, okay, thank you. So now what we'll do is we'll look at the 7th cranial nerve, which is the facial nerve. And you can just kind of follow what faces I make. I just want you to raise your eyebrows. Good, and then close your eyes nice and tight like you got soap in them. Good, and then blow out with your cheeks. Good, and don't let me blow the air out. Alright, very good. Good, so now what we'll do, I'm going to have you back to eyes closed, and I'm going to just make a little bit of sound with my fingers in both ears. Same thing as before, I just want you to point to whatever side you hear it from, okay? Good. And that was the 8th cranial nerve. Now moving down, what we're going to do is look at a couple nerves that control a little bit lower in your mouth. So actually what I'm going to do, I'm just going to have my hands right here, and I just want you to swallow for me nice and simple. Good. And then can you stick your tongue out? Good. And then move it side to side as it's out. Very good. Open your mouth and say, ah.
Ah.
Good. And now what I'll have you do, you just relax your arms at your side. Good. And then I'm just going to apply a little bit of pressure. I want you to bring your shoulders up towards your ears. Good. Yeah, there you go. Good. And then just looking right at me, you can just turn your head side to side. Good. Other side. And then up and down. Okay. And you feel okay?
Mm-hmm.
Alright, great. So yeah, we assessed all 12 cranial nerves, and all of them are normal. They have their full integrity. And now what we'll do is we'll move on to dermatomes and myotomes. So basically, the segments in your nervous system, in your central nervous system, they come out of, the nerve roots come out of different segments in your spine, and they innervate different areas of skin and different muscle groups. So I'm just going to be testing them. We'll start with dermatomes. So what I'm going to do, similar to what I was doing before, I'm just going to lightly brush on different parts of your skin. I want you to tell me first if you feel it, and as well if you feel it equal on both sides, okay? And if I could just have you move your hair out of the way. Okay. So starting with C2 up in the high collar. Feel that? No, you can keep your eyes open. You see one here. Good. Feel that?
Mm.
Okay. You feel that equal? Okay, moving down to C5. Equal?
Mm.
Okay. do, I'm just going to move on to your legs. You can have your legs relaxed right here. Starting with the L2 nerve root. Feel that equal?
Mm.
Okay. Equal. Equal. Okay. And if the camera can see me, I'm down at the medial malleolus and the dorsum of the foot equal. Lateral malleolus equal.
Mm.
And then behind the calf equal. Okay. So same thing, dermatomes all negative. She feels equal sensation on both sides. Now what we'll do is we'll check for myotomes, and this can also give me a good idea on her manual muscle strength bilaterally. So what we'll do, starting here, I just want you to tuck your chin. Good, and I'm just going to lightly try to pull your head up. Don't let me. Good. Look right at me, and I want you to, I'm going to push your head almost into that direction, pushing your ear towards your shoulder, okay, and just don't let me. Good. Good. Now what I want you to do, I want you to lift your shoulders up, good, and don't let me push them down. Bring your arms up here, just like that. Don't let me push them down. Very good. Make a muscle with both your hands. Good. I'm going to try to pull them out. Don't let me. Good. Now what I want you to do, I want you to push them straight out against me. Very good. And then you can have your hands here. I want you to curl your wrists up. Good. Don't let me bring them down. Good. And same thing now. Just flip over and bring your wrists up. Good. Don't let me push them down. Good. Now what I want you to do, I want you to spread your fingers. I'm going to put my fingers in between yours. Now I want you to squeeze them. I'm going to try to pull my fingers out. Don't let me. Good. And I slipped a little because of the lotion, but it's alright. Now what I want you to do, I'm going to test each side here. I want you to bring your knee, lift your leg up off the table. Good. And I'm going to try to push down. Don't let me. Good. And the other side. Good. Okay, now what I want you to do with this leg, I want you to kick it out straight. Okay, kick. Good. Okay, the other one. Okay, kick. Very good. Now what I want you to do, I want you to lift your toes up, almost like you're bringing them towards your knee. Good, and don't let me push down. Good. This one too. Good. Now what I want you to do is kind of the opposite of that, like you're going to floor the gas pedal. Let's go on this one. Good, and then this one. Point down, nice. Good. Now if you could just scoot a tiny bit forward, what I want you to do is, I'm going to try to pull your leg out straight, okay, and don't let me. Good, and then this one. Don't let me. Good, okay. Alright, so those myotomes are all, as well, negative for any fatigable weakness. She also expresses good bilateral strength. It's pretty equal on both sides. So what I'm going to do now is I'm going to test for your reflexes. I'll do a couple in your upper arms and your wrist, and then a couple in the lower body, okay? And this should not you should not have any pain in this. You might feel the muscle jump a little bit, but it's completely normal. And what I want you to do is, just as best you can, just try to relax your arm. Good. And just try to relax your arm. There you go. Good. Okay, here. Good. Good. Okay. Just curl my hand a little bit with your fingers. Good. Not too tight, just kind of curling around. Good. Good. And then this one. Good. And while I'm here, I can also just sit right next to my patient and check for a Hoffman's reflex, which I'm going to grab the middle finger and just give it a flick, and that's negative. As well here. Good. And that's negative. Now moving down, I want you to just scoot up a little bit so your legs are hanging off the bed. Good. And same thing, you can actually grab both your hands and just give them a pull apart. Good, right there, and just try to relax your legs as best you can. Good. Good. Okay. I'll take your ankle here. Good. And same thing, just let it relax. Good. And then here too. Let your ankle relax. Good. Nice. Alright. Now we're going to look at my patient's balance, coordination, and check for any movement disorders. She's already displaying good seated balance, but what I have you do here is just close your eyes. Good. And that can demonstrate that further, that she has very good seated balance and she's completely independent in sitting. Now what I want you to do, I want you to hold your hands out just like this. Good. And just hold your hands right there. Good, and loop and relax. Checking for a rebound phenomenon, also a negative. They're responding very well. Now what I want you to do, just with one hand, actually go ahead and close your eyes. And with this hand right here, go ahead and touch your nose. Good, and switch. Good, okay, you can open your eyes. Same thing, touch your nose. And what I want you to do is touch my finger. Good, touch your nose. Touch my finger. Touch your nose. Good, let's go with the other hand. Touch my finger. Touch your nose. Touch my finger. Touch your nose. Okay, one more time. Go ahead and touch my finger right here. And then touch your nose. Now what I want you to do is close your eyes and try the same thing. My finger's in the same spot as it was. Go ahead and try to touch it. Very good. Alright, and back. Nice. Okay. Now next thing I want you to do, you can let your legs relax. I want you to bring your leg up. So it's right here. Good. And then go ahead and drag it up the shin and back down. Good. Same thing on the other side. Drag it up the shin and back down. Nice. Very good. Okay. Last thing I want to do is checking for something called dystiodocokinesia. So basically what I want you to do is you can just make a nice platform for your hand here. The other hand will be here. And I want you to just flip nice and easy back and forth. Good. And then let's go with the other side. Good. Nice. And you can come seated off a little bit so your feet are flat. And what I want you to do is, as fast as you can, with one hand, tap. Good. And then the other foot, tap. Nice. All right. So my patient displays good coordination, no signs of tremor, movement is very fluid, no dysmetria, and no dystiodocokinesia. Before we move into laying down, I just want to do one more. What I'm going to have you do, I'm going to actually show you what I'm going to do to you. This is going to be the dull side, okay, and this is going to be the sharp side. Okay, I'm going to have you close your eyes, and I'm going to apply this different dull and sharp, and you're just going to tell me which one you feel, okay?
Dull. Sharp.
Okay. You okay?
I was sneezing. Okay.
Alright, flip your hand over, same thing, close your eyes. Tell me what you feel.
Sharp. Dull.
Okay, and other hand.
Dull. Sharp.
Flip.
Dull. Sharp.
Alright, awesome. So that is from the Asia chart, the 2-point discrimination, and as well, all good there. So now what I'm going to have you do is move into laying down, and I'm actually, I think the camera angle should be okay. If you lay with your head over here, good, and if the camera can see you. And what I'm doing here is I'm testing for spasticity. So what spasticity is sometimes when you move your limb, either fast or slow, depending on what velocity is, you might have a little bit of catching. So what I'm going to do is just take a couple of your joints through some ranges of motion. All you have to do during this is just relax. Okay? So I'm just going to go nice and slow here. Good. And slow there. Good. Okay, same thing at the wrist. Good. Okay. Same thing at the knee. I'm just going to bring your leg up. Good, and just let it relax. One more at the ankle. Let your ankle relax best you can. Good. Okay. And for the sake of time, and I don't really have a table, I would test this bilaterally. I'd probably also do the shoulder and the hip, as well as maybe some of the abductors on both the shoulder and the hip. Okay. So now what I'm going to do is I'm going to have you come back up into sitting to the posture that you were in before. So go ahead and do that. Good? Okay. And before we get started with this next test, I'm just going to have you remember 3 words for me, okay? So the words are banana, sunrise, and chair. Okay, so what are the words?
Banana, sunrise, and chair.
Good. Okay. And before as well, when I first came into the room, I had my demonstrated that my patient was alert and oriented to person, place, and time. And now what I'm going to have you do, just as next part of the test, I drew a circle here on this blank piece of paper. And what I want you to do is just go ahead and draw a clock, okay, and make it say 10 minutes past 11. Okay, and my patient was able to complete that clock drawing, make it say 10 minutes past 11 with the little hand at the 11, the big hand towards the 10. And then before we move on, can you just repeat those 3 words that we said before?
Put on a sunrise chair.
Great, okay. And that was part of the mini cog screen, and that's negative. She has no cognitive impairment or anything that I should kind of be concerned about cognitively. Okay, so now what I want you to do, real simple, we're just going to go for a little bit of a walk, just back and forth in the room. So what I want you to do, just have your feet flat on the floor and just stand up for me. Good? Okay, can you turn towards me and just take a couple steps? Good, and then face the camera, same thing, just walk towards the camera. Good, and then back into sitting. Okay, so my patient was able to pretty much do everything independently. Sit, stand, go into supine, back up into standing, and walk back and forth. She's completely independent. Just to recap on what I was doing, the cranial nerve testing, dermatomes, myotomes, DTRs, all negative. Everything is pretty normal. Reflexes are at a 2, so those are normal. Negative for any spasticity, any movement coordinations, balance disorders, anything like that. So yeah, this concludes our neurological examination. You did a good job. Thank you very much for helping me out.